Hello and good evening. My name is Carla and my group and I are going to go ahead and be discussing neonatal nursing. But first and foremost, we're going to go ahead and start off with a Bible verse and New International Version, 1 Peter chapter 2, verse 2. And it says, like newborn babies, crave pure spiritual milk so that by it you may grow up in your salvation. So moving forward, I'm going to go ahead and introduce the rest of my group, and we're going to have Erin discussing the history behind the neonatal nursing, and then we're going to have the Dustin discussing the influential natal nursing figures, and then we're going to have Haley talk about the pathway to become a neonatal nurse, and then Isabel, who's going to be discussing types of neonatal nursing, and Araceli is going to be discussing the duties of a neonatal nurse, and lastly, Jessica is going to be discussing the neonatal nurse statistic.
Hello, my name is Erin. I will be explaining the history of the NICU department. So to start off, the whole idea of the newborn care became a priority for Pierre Constant Boudin, a French obstetrician who wrote about the success of incubators. Incubators help keep the baby warm because premature infants can't create their own body heat. However, by the Second World War, hospitals began treating newborns finally and prioritizing them, and by the 70s, there was a program that encouraged more visiting hours for parents, involving the father more in the birthing process, and emphasizing the special bond between mother and a child. Care continues to improve for premature infants with new technology and awareness for sick and premature infants. I'm going to hand it to Dustin, who will be explaining the influential neonatal nurses who helped shape the department into what it is today.
I will be talking about a couple of influential figures in neonatal nursing. Dr. Etienne Stéphane Tarnier was a French obstetrician who recognized the specific needs of premature babies. He understood the importance of external heat and humidity for their survival and growth. His creation of a simple isolette inspired by heated boxes used by farmers served as an early prototype for modern incubators. Dr. Pierre Constant Boudin, another French obstetrician, dedicated his career to caring for at-risk babies and reducing infant mortality. His contributions included educating mothers about proper nutrition and hygiene, promoting breastfeeding over cow's milk, and advocating for the use of a gavage, a feeding tube, to nourish premature babies. And finally, Dr. Julius Gluck, who made significant contributions to infection control and the design of neonatal care units. Through his research, he highlighted the heightened risk of infections in newborns, particularly in premature babies. He identified poor hand hygiene as a major cause and took proactive measures to address this issue. Dr. Gluck created new hand-washing protocols and redesigned the layout of special care nurseries, consolidating isolates and incubators into a single room. This innovative approach reduced the risk of infections and led to the opening of the first American neonatal intensive care unit, known as the NICU, at Yale New Haven Hospital, marking a significant milestone in neonatal care and setting new standards for the field.
The first thing that you would need to do to become a neonatal nurse is to earn a bachelor's degree in nursing. You can't move on to a graduate program with only an associate's degree in nursing. However, if you only have an ADN, you could either take an RN to BSN bridge program or an online BSN program. Once you have earned your BSN degree and received your RN license, you would want to gain experience in a neonatal intensive care unit or comparable clinical experience. This is so that you can be accepted into an MSN Master in Nursing or DNP Doctorate Nursing Practitioner graduate program. You will need to earn either your MSN or DNP from an accredited program with a specialty in neonatal nursing. This is an MSN to NP program, which is for students who already have their BSN and enroll directly in the program at the graduate level. There is also a DNP program that allows students to receive their doctorate degrees while meeting the requirements to become an NP. This is for more of an academic or research-based setting working environment. The program could take 2 to 3 years to complete. After you complete the program, you have to sit for their boards to receive your neonatal nurse practitioner certification. After completing the specialty certification exam, you would need to become a board certified in the specific state of practice. Requirements vary state by state. This last slide is an overview of what I just talked about. Next, Isabel will be speaking about the different types of neonatal nurses.
There are 3 different levels to neonatal nursing. A level 1 neonatal nurse works with healthy newborns and is specialized in neonatal resuscitation, care, and stabilization for newborns who are ill and born at less than 35 weeks gestation. Some of the tasks they regularly perform are hearing tests, vision tests, deliver shots, and bathe, also helping with mothers learn to care for their newborns. A level 2 neonatal nurse has all the same specialties as a level 1, but more. They work with newborns that are born at 32 weeks gestation and have moderate illnesses. These nurses work with infants in a special care unit. Some of the additional tasks that they perform are mechanical ventilation and working with them so that they can eventually breathe on their own. These nurses are specialized in intravenous fluid administration, specialized feeding, oxygen therapy, and medications. A level 3 neonatal nurse works in the neonatal intensive care unit and works with infants with congenital problems or who are born very premature. These nurses have all the same skills as a level 1 and 2, but are also specially trained to work with a high-risk infant. These infants may need incubators, ventilation, surgery, sustained life support, and have very low birth rates. They also may need to work and meet with variety specialists and be monitored consistently.
We'll be speaking on the duties of a neonatal nurse. First, I will start with where neonatal nurses may work. Most neonatal nurses tend to work in the intensive care unit, although some nurses may also work in the community to help out mothers and parents once a baby has been discharged from the hospital. Neonatal nurses will work with babies who are less acutely ill to even critically ill infants. Some neonatal nurses may even attend high-risk deliveries of babies. The overall main focus for a neonatal nurse is to care for the babies and monitor their health. Some daily routine duties of a neonatal nurse include bathing, feeding, changing diapers, and vital assessments for the babies. Although some more specific duties of a neonatal nurse include preparing and checking medication, managing a baby's fluid, documenting the baby's care, and tube feedings. Now, I will pass it on to Jessica, who will speak on the statistics of neonatal nursing.
Hi, my name is Jessica, and I'm going to be going over statistics and the demographics of a neonatal nurse. Today we'll be covering age, race, gender, and salary. So for a neonatal nurse, as we can assume, 89.4% are women, and men are at a 10.6% according to Zippia. So this you see in every almost hospital setting and any specialty. You see more women in a nurse's position than you see men. And then for ethnicity-wise, we have white neonatal nurses at a 65.2%, Hispanic or Latino make up an 8.8%, Black and African American are at 12.0%, Asians are at 9.3%, and American Indian are at 0.5%. So what age groups make up these ethnicities? So we have 14% are between ages of 20 and 30 years old, 59% are 40 and plus. So now we're going to be going over salary. How much does a neonatal nurse make? So according to the United States Bureau, neonatal nurse specialty is one of the highest paid specialties in nursing than any other. So their average salary pay a year is $88,160. So this does vary from location of where the nurse is working and experience to determine income. So obviously even a nurse with more experience, a BSN, will make a little more than this average year pay. And then the 3 states, according to the United States Bureau, that are the highest paying nursing neonatal nurse states are California, Washington, and Pennsylvania.
Okay, so now that you know a little bit more about neonatal nursing, here is a quick video that shows you the day-to-day life of a neonatal nurse.
It's something you can't really put words to, but just kind of that feeling of okay, I did something good for this family, and it's a memorable moment. You know, people's lives change every day on my unit, and I might not remember every single one of them forever, but I know that they will. The more common struggle that we have in our setting is just nobody wants to be in the NICU and under any circumstance. That's not what anyone signs up for or thinks is going to happen. And so just the whole grief process, even if the baby ends up leaving perfectly healthy when it's all said and done, helping guide the family through losing the experience of having a happy, healthy delivery is really hard for people, and just kind of dealing with that and trying to explain why they really need what they need and how long they're going to be there. That's the number one question, is when are we going to be able to go home? And that always just depends on the baby and what they're able to do. If I've had a day where I've been able to do something like that, where I've given them some kind of space to create a bond with their baby, that, you know, I'll never forget the first time I did fill in the blank, changed your diaper, checked your temperature, whatever it is, it really gives me a sense of, like, okay, I did what I was supposed to do today. I kept the baby safe, I did my hard job, but I also helped them establish a connection and become a family.
Hi again. We hope that you now have a better understanding of what neonatal nursing is. And if you do have any other further questions, feel free to reach out to us. But I have attached 2 frequently asked questions, and one of them was coming from a student: what is the hardest part about being a neonatal nurse? And the answer is, it's emotionally stressful. Working in a neonatal nurse department is an extremely high pressure job. The neonatal nurse department staff is responsible for the lives of tiny, unstable babies. And maybe a frequently asked question coming from a parent or guardian of the baby, and they may ask, why is the baby here? So various reasons, and Araceli spoke about why they would care for a baby. It could be because they're ill and maybe too weak to breathe on their own or not eating enough. But we hope that you enjoyed learning about neonatal nursing, and we thank you for your time.